Welcome back to another episode of Spilling the Tea with Lava Lamp.
Shade. Yes. I don't know if that's the name yet. Again.
Well, this is the third episode and we still don't have a name.
So I
So
guess we're spilling the tea.
maybe we should call it Lava. Talking with Lava.
The Lava Lamp Show.
Today, I decided not to sleep. I just couldn't fall asleep, not for even a second.
I know, and that is
Here we
actually
are.
what we're talking about. Your testosterone is probably not doing very good today.
Can you believe we're talking about this today?
Yeah.
Out of all the days today.
Well, your cause was that you took medication that keeps you awake at night. So you took prednisone for some pain you're having in your arm to reduce inflammation, but prednisone can cause you to stay awake. So you're not supposed to take it at night. When you told me last night, you go, I'm taking some medicine for my arm. I'm like, I hope he means Tylenol.
Talk about lifespan and sleep and yawning. Today, we're going to discuss a very important topic, which is the relationship of sleep and testosterone.
Yeah.
Correct?
That's correct. So questions I get a lot is if I sleep more, is that going to help my testosterone? And is my sleep patterns or my sleep behaviors impacting my testosterone? So I thought, great way to target that topic and come and talk about it here.
Yeah.
And answer some common questions I get. Hopefully, if you have other questions, leave them in the comments below, and then we can address those as well on a follow-up video. But yeah, so let's dive right in. Let's get jiggy with it.
Let's do it. To get started, let's start with the basics.
Let's get to the basics.
What is testosterone?
So testosterone is the male-dominant sexual hormone that is produced. Typically starts to peak when we reach puberty. And so in our early teens, 11, 12, 13, you're going to see a surge in this hormone, and it's going to help us develop our male sexual characteristics. So deepening of our voice, hair growth, sexual characteristics, increase in lean muscle mass, increase in our height and our growth is also an important part of that sort of explosion throughout puberty. But it's also really important for pretty much every aspect of being a male and how we develop and how we function. But yeah, so and it's in females too. It's still a very important hormone for them. They just have a lot less, and still it impacts their sexual drive and some of their sexual functions as well.
Wow, I didn't know that.
Yeah, some women, when going through menopause, they start to lose their sexual urge or libido as well. And so they'll get prescribed testosterone too, usually in a small, low dosage, usually a cream or ointment or gel. But yeah, women can take testosterone to increase their sex drive.
Why is testosterone so important for men?
Yeah, so it really impacts pretty much every biological function that we have. Everything from you can start at the crown of your head down to your feet and think of your memory and how your body creates memories and stores memories, your concentration, your motivation. It impacts our energy levels and whether or not we feel fatigued. And it is also going to, of course, affect our sex drive. It's a sexual hormone, so it's going to impact our libido, how hungry we are as far as our sexual appetite. It's going to also impact our sexual function. So creating an erection, maintaining an erection. It goes beyond that into really affecting how our body stores fat and creates our body composition. So where it places fat, where it creates muscle, and how muscle maintains its growth and maintains its strength. And really in everything you can imagine that is a part of your daily life is somehow related to your testosterone and how it is impacting you throughout the day. So it's important.
Other than the impacts that you mentioned, does testosterone have another impacts on the molecular levels?
Yeah, so beyond just these fancy terms that are pretty vague and how the way it makes us feel and how it makes things move, testosterone is also going to be impactful at that molecular level. Some of the things we know is that testosterone impacts our red blood cell count. So as our body's making new red blood cells, which is important for how our body delivers oxygen to our tissues, that is the main culprit, is testosterone will stimulate that. Testosterone also keeps our bones strong to prevent osteoporosis or the weakening as we age, which is why some men, as their testosterone decreases over time and they get older, they have an increased risk for fractures or breaks in their bones. And then, of course, it also stimulates and modifies fat cells and muscle cells. So it tells fat cells, hey, there's a lot of me around, there's a lot of testosterone around, we need you to shrivel down and we want to use that energy somewhere else so it can make fat cells shrink. And as far as muscle cells, it tells them, hey, we need you to be more active. So it'll make muscle cells grow and be more metabolically active so they use more energy.
Wow. Fascinating.
Yeah. And it's funny because I learned all of this being a patient myself, right? I mean, you learned a little anatomy and physiology layers throughout medical school and in residency, but because this isn't something that we primarily practice in primary care, it's a 1 to 5% of maybe what patients would come into us for. It really took me becoming diagnosed with low testosterone and developing this passion as a patient myself and really digging deep into what testosterone is and how it really affects every aspect of the male life.
It's fundamental.
It's fundamental.
Let's talk about the correlation of sleep and testosterone. How does testosterone impacts our sleep and how sleep impacts our testosterone?
Yeah, so testosterone has a bidirectional relationship with sleep as well as pretty much everything else that it impacts. That means if our sleep suffers or if we have poor sleep, then we're going to have poor testosterone values. And inversely, if our testosterone is low, it's going to cause us to have poor sleep. So it's sort of like this cycle of what comes first, the chicken or the egg. So some people, they have a disruption in their sleep cycle, which then causes their testosterone to start to decrease. That decreased testosterone can then further aggravate and make their sleep cycle worse. And other people, maybe stress or dietary changes or weight gain causes their testosterone to decrease. And that itself causes their sleep patterns to suffer. So there's that bidirectional relationship. We don't know which comes first, the chicken or the egg. Every patient's a little bit different.
And where in our body is produced testosterone? Is it the brain? Is it the gonads? Where does it come from?
Right. So it's a complicated process. Testosterone technically is produced by the gonads and the genitalia, but it's stimulated from our brain. And of course, that is a highly important processing area that is heavily dependent on sleep. And so the brain has these mechanisms in which chemicals are stimulating certain areas of the brain to then stimulate the gonads to make more testosterone. And so it kind of comes from both. But if one is impacted or if one is damaged, it can result both ways, there being a problem with testosterone production.
Are we constantly making testosterone all the time, or we make testosterone at a certain time of the day? Like how does that happen?
Testosterone is a cycle. So it kind of comes throughout a rhythm is how they like to describe it. Just kind of like our circadian rhythm or how we sleep and how we wake, that sort of sleep and wake cycle. So what we know is that testosterone is mostly produced while sleeping and early in the morning. So you're usually going to have the highest amount of testosterone first thing when you wake up. And usually by the end of the day or late afternoon, your testosterone has plummeted, as that's oftentimes why we feel so tired. For patients that have high or optimal testosterone levels, this cycle or rhythm doesn't really create an impact. Imagine it if you're on the higher end of the curve, even when your cycle is low, you're still considered in the middle area of your testosterone values where they're not really impacting how you feel. But if you have middle or low range testosterone values, and then late in the afternoon, your low is going to be much more substantial than someone who has optimal levels. So you're going to feel those results of having low testosterone more significantly, especially in the afternoon and the evening time before going to bed. And that's also, of course, going to be how it impacts your sleep. So if your testosterone level is at its lowest right before you're going to sleep, and you have low testosterone, it's going to make a significant change and impact in how you're able to fall asleep or stay asleep.
That makes sense. It also makes sense why we tell patients if they want to get screened for low testosterone to go
later in the
day, because in the morning they might produce more testosterone.
Yeah, so it's interesting because typically the insurance companies and your primary care doctor, who is often tied to what insurance is going to reimburse them for, will tell you to go get your testosterone screened first thing in the morning. Ooh. Because they know first thing in the morning, your testosterone is going to be at its highest. Yeah. So how is this helpful? How is that going to tell us if you're right over what is considered normal first thing in the morning? Imagine how you feel late in the day. And so they just want you to suffer. So they just want to scoop the top of the people who barely have low testosterone. Mm-hmm. And so many people with these concerns get skipped or missed. And that's a lot of our patients come to me. They're like, my doctor, my testosterone value is 300, but he says it's normal. Or my testosterone value is 280. He says it's normal. And I'm like, well, when did you get your test done? How many times were you tested? And ultimately, of course, medicine is an art form. We all approach it differently. It's just important to explain to patients why you're doing something. So maybe tell your patients, the reason I'm having you go get your testosterone checked first thing in the morning is because that's when it's its highest.
Right.
So then your patient can think about it and say, why does my doctor care where it's its highest? Shouldn't he want to know where it's its lowest and how it's affecting me throughout the day?
So that you can treat the patient.
Yeah, but if you scoop less patients positive for low testosterone, insurance companies save a lot of money. Less people get, the diagnosis and money gets saved for the insurance companies. So it's interesting. And of course, that's my perspective on what's going on. I just have never really understood. I've talked to multiple urologists, endocrinologists. They also agree it doesn't make sense to have your lab screened when it's at its peak. We don't do that with anything else. You wouldn't be like, we're going to see if you have thyroid disease, but I want you to go get checked when your thyroid production is optimal, and we're not going to check it when it's at its lowest. It doesn't really, but that's just how things go.
When you say quality sleep, what do you mean by that?
Yeah, that's a complicated question, right? Quality sleep. Does that mean amount of time or how deep you sleep? And there's not really a good clinical measurement of what quality sleep is. Of course, we have some guidelines where we know between 7 to 8 hours per night is what's recommended. But what's most important is we need your body to go through the stages of the sleep cycle. And there are multiple, but 2 stages are the most important when falling asleep in regards to testosterone production and hormone production. That's going to be our REM cycle and our deep sleep cycle, or slow wave sleep. So those are the 2 you want to make sure you get plenty of while you're sleeping to have quality sleep.
What is the importance of the cycle of sleep?
Yeah, so each cycle has different functions that occur while you're sleeping. So an example, the number 1 that you're going to reach that's important is called REM cycle, or rapid eye movement. So this is characterized actually by your whole body being paralyzed except for your eyes. So you may have seen me fall asleep, or I may have seen you, and you'll see like your eyes are closed, the eyelids are closed, but you can see the eyes moving around. Typically, this is also the dream state. So you're having dreams here. But what we know is that the body is shunting a lot of blood to the sexual organs during this cycle. And so, of course, that is going to give them all the nutrients they need to properly produce that testosterone. While testosterone is signaled from the brain, the production occurs in the gonads. There needs to be lots of blood there, lots of nutrients to make sure that it's able to produce adequately. That's number 1, an important sleep stage we need to enter. And the second important sleep stage is called slow wave or deep sleep. And this is what's considered the most important for restoration, allowing our body to sort of reset. We also know not only is testosterone produced highest at this point, but also growth hormone. And that's an important factor that helps us to literally grow as we get older. We see this spike a lot throughout puberty, helping us to literally grow. And as we get older, growth hormone does not stay high, and it's certainly not something you want to play with. There's some patients of mine who are like, hey, what do you think about taking growth hormone? Absolutely not. That function is over after puberty. You just trinkle out little bits as we sleep. The more important thing that you can impact and we can change medically would be that testosterone value, because we have a very bioidentical hormone, and testosterone can continue to peak beyond puberty, whereas growth hormone really hits its peak there, and then you need to let yourself just ride it out.
When is the peak of the growth hormone?
So the growth hormone is meant to help your cranium grow, your hands grow, your feet grow, your genitalia, your body. So if you take growth hormone later in life, it's going to do the same thing. You're going to have something called acromegaly, where your skull and your cranium can grow. You can create like a mongoloid facial features. Your hands can get bigger than the rest of your body, feet as well. So you don't want to play with something that can have such a dramatic negative response. So I usually say stay away from growth hormone, even if you see ads for it on the internet. Not something you want to play with without a very specialized endocrinologist who you have vetted, who knows what they're doing.
They do that on telemedicine?
No, not any reputable telemedicine company that I've seen, but usually you would see endocrinologists only prescribe this to young kids who aren't growing properly, and that's even at the most severe cases, because again, the side effect potential and the adverse negative responses are way larger than the benefit could be.
Those sleep cycles that you mentioned, do they change over time or as we age, or they are still the same?
Yeah, so as we get older, specifically slow wave or deep sleep gets less and less. And sometimes when we're in our much older years, 50s, 60s, 70s, we don't have any at all, which is why oftentimes men wake up feeling horribly unrested, or they need very little sleep because they're never even hitting that deep restorative sleep. So it's almost like not worth it. And they get no testosterone production out of sleep. And so we see these critically low values for a lot of older men because they're not having that full sleep cycle. We also don't really know, is testosterone causing this as we get older because we're producing less testosterone? Does that mean it's impacting our sleep to where we're not reaching slow wave sleep? Or are we not reaching slow wave sleep, which then causes our testosterone to fall? So we don't know which one is which. But ultimately, we do know that if your testosterone values are optimal, you are going to hit slow wave sleep more often and more regularly. So it can be a treatment option for some older men that have low testosterone and have insomnia.
Hypothetically speaking, what will happen to someone's testosterone if they were sleeping less?
Even just one short night of missing quality sleep like you had last night can have a 50% reduction in the amount of testosterone that you'll produce that following day, which then can subsequently continue. And as you know, and hopefully we can fix tonight, when you miss a night's sleep or your sleep is disrupted, you often will nap during the day and then your sleep pattern is just off, right? So it's hard to fall asleep again on time tonight and then the following night. Lucky for us, we're pretty good with sleep hygiene and I'm sure we'll be fine. But in general, you want to make sure that you don't let this become a chronic sleep issue because that's where over time, day by day, having that disrupted sleep cycle can not only slash your testosterone in half, but in half again, and then again. And before you know it, it's making a substantial difference. And so, yeah, so even these short term periods where you have poor sleep, you need to know it's going to impact you over the long term, especially if you don't correct that behavior quickly.
I'm going to sleep good tonight, I promise.
Sleep good tonight.
Does sleep have a relationship with other diseases other than low testosterone, for example?
Having bad sleep or poor quality sleep is not just going to impact our testosterone values. There's many other chronic medical conditions that have been associated with insomnia or difficulty falling asleep or staying asleep. We see an increased risk of developing high blood pressure. Of course, that can be due to sleep itself, not being able to restore and repair blood vessels, but also the fact that poor sleep causes an increase in stress. We also see a very similar relationship with heart disease or the development of atherosclerosis or the development of clotting or plaque developing on blood vessels. We also see an increased risk of developing diabetes. So all of these sort of inflaming conditions can occur because the body's not able to rest. Something else we also know about testosterone in regards to inflammation is that testosterone is highly anti-inflammatory. So having optimal levels of testosterone helps your body to reduce inflammation that would be occurring and could potentially cause things like high blood pressure, heart disease, diabetes, all these inflammatory conditions that we're seeing increase, especially now in the state of where medicine is and health is in the United States.
What signals are happening in our body due to poor quality of sleep?
Yeah, so when we are not getting adequate sleep, of course, it's going to impact our testosterone values, but how is this happening? And there's three main ways that we think that this is happening. And number one is that it's impacting the relationship of the hormones that are getting signaled from our brain to our gonads. So our brain, specifically the hypothalamus, is kind of what we call the control center. So it's going to be important in regulating our temperature. So our body temperature and how we sweat, things like that. Also, it affects our appetite. It also is going to release important chemicals to tell our body to continue certain processes. But if it doesn't have adequate sleep, if it's not functioning normally, it will impair its release of chemicals that signal the brain to tell the testosterone producing gonads to function normally. So we know that the hypothalamus is going to be impaired when sleep is disturbed. Secondly, we know that somehow melatonin is involved. Of course, melatonin is an important factor in telling us, hey, it's time to go to sleep. You can take supplements for melatonin, but we do know that if your sleep is low, thus having a low testosterone production, it can also impact how melatonin is produced. And so we know that there's a relationship there. It's very complicated. What we also know is those supplements for melatonin, while they can help you fall asleep, they are not going to impact your testosterone values whatsoever. There's no relationship between the two. So I wouldn't try to take a melatonin supplement thinking, oh, it's going to help boost my testosterone. There's no evidence for that. And finally, something that's probably the most powerful stimulation that happens when we don't sleep well is an increase in cortisol. So cortisol is basically the hormone that our body will release when we're under severe stress or even small amounts of stress in hopes to reduce the impact of that stress on our body functions. And so cortisol has an inverse relationship with testosterone. So if cortisol is high, testosterone is always going to be low. And you can sort of think of it as the root cause of our fight or flight system, which you may have heard of. It's commonly described in English language when you're going through health class. And that's like our adrenaline system. So your body is either at a state of fight or flight whenever you're, scared or nervous. And so the last thing your body's concerned with when you're trying to either fight or flight is your testosterone production. You're not worried about getting an erection or having another baby. You're trying to get out of an emergency situation. And that's supposed to be temporary. So cortisol goes high in that situation to help your body cushion the blow of all of that adrenaline. But the side effect of that is that it's going to impact these things that are supposed to be temporary for long periods of time. So again, cortisol is going to increase and going to cause a lot of catastrophic results, especially as it continues is impairing your testosterone production.
So what are the lifestyle changes that we can make to improve our testosterone values?
Yeah, so it starts with sleep. Like we've been talking about, having adequate sleep, sleeping 7 to 9 hours a night is going to be really beneficial. Some studies say even over 8 hours may be too much, but really 7 to 9 would be considered the golden time frame. And of course, it's not easy to always get there. So practicing sleep hygiene, avoiding screen time a couple hours before going to bed, making sure that where you go to sleep is only intended for that use. So if you have trouble falling asleep, you got to get rid of the TV. You need to not be working in your bedroom. You need to make that a place just for sleep and ultimate relaxation. Other things, of course, exercise is super important. Not only is it going to help you with your typical sleep routine and help you to improve symptoms of insomnia, but of course, we know exercise is one of the best ways to naturally increase our testosterone. So if your testosterone is low and that's causing you to have a difficult time falling asleep, exercising is going to increase that and improve. And so again, these things have multiple directions in which the relationships are sort of correlated. So exercise, sleep, diet is huge. So you want to avoid processed foods as best as you can. Think of processed foods as anything that has multiple ingredients. It's really that simple. So an apple has an apple. That's all the ingredient
Right.
is. When you go to buy peanut butter from the store, especially if it's Jif, there's 45 ingredients. That's not an unprocessed food. You can make your own at home. Just throw some peanuts in a food processor. That's a one ingredient food. So stay to those limited ingredient foods. The more processed and the more additives, the more likely it is to impact your hormones, because those chemicals do things in our body. So all those things are pretty much the basics in regards to what you can do at home and change lifestyle wise that will improve not only your sleep, but your testosterone function.
Is it true that if you exercise 2 hours before sleep, you're going to have poor quality sleep or you're going to have trouble falling asleep?
That is true for some people. An example being, I can go to the gym and work out and fall asleep right away. Some people, it's not so much that your quality of sleep will be disturbed from going to the gym, it's that it's hard to fall asleep after. After getting done with a workout, your blood has been pumping, your brain has been activated, your body is awoken from all of that stress hormone release. But typically, this is more so for people who aren't used to working out. So if you're going to start your workout routine just now today, I don't recommend starting it before sleep. Start it at a time that is going to give you plenty of time afterwards to see how you respond. If you know a few hours after a workout, you're starting to feel tired and you can fall asleep, totally fine. That's perfect time for you to work out. But some people can go to the gym and afterwards they're going to be quite stimulated after, and it's just going to affect how fast they can fall asleep.
So to summarize everything, how does getting enough sleep affects the hormones in our body, especially testosterone?
So we want to make sure we're getting a full night's sleep between 7 to 9 hours so that your body is able to go through all those important cycles and their stages of sleep. That's because not all of them are the most important. We need to hit two often. So that's going to be REM sleep and deep or slow wave sleep. Those need to be a part of our routine nightly so that our testosterone production can be optimal, as it's typically produced the most in the late evening or early onset of when we wake up. And so you can imagine, as we're just starting to wake up is when our body is producing its maximum amount of testosterone. It has just gone through a full night's sleep, hopefully have hit that REM cycle a couple times at least, and as well as multiple stages of the slow wave sleep cycle, so that your body is finishing up that production and you're able to move on. So that's again why it's so important that we have a nice long, well-rested sleep each night to ensure our testosterone values are optimal.
Is there any scientific study that tells you that sleeping better can boost testosterone?
Absolutely, especially for patients that have a difficult sleep hygiene or sleep process already. So if you come to me and say, I'm concerned, I have low testosterone, and we check your values and your testosterone is suboptimal, and then we talk about your sleep hygiene, you're like, yeah, I can't sleep throughout the night. And then we talk about making adjustments and you start sleeping better. Over time, your testosterone is going to improve. But if you're already sleeping well throughout the night, you're getting 7 to 9 hours and your testosterone is still low, that's obviously not the problem. So trying to improve that by sleeping more or adding different things into your routine in regards to your sleep schedule is not going to make an impact. It really just depends on who you are, and if your sleep is already poor, that could be, of course, the main cause, and improving that sleep hygiene will thus improve your testosterone values.
Will thus improve.
Will
Wow.
thus.
Wow, you're watching too many movies, honey.
I'm watching a lot of Achilles.
Are there any foods or supplements that you can take that can improve your sleep quality consequently improve our testosterone production?
So there have been a lot of studies on whether or not sleep aids or sleep medication can actually improve the quality of our sleep and how it affects the stages of our sleep. Unfortunately, there's not a great medication that makes you fall asleep and stay asleep that actually has a positive impact on all the stages of the sleep cycle. So unfortunately, there's no supplement, even melatonin, that's going to
Yeah.
really make a massive improvement in your hormone production. Yes, it can help you fall asleep and stay asleep. And sometimes that's all you really need to just kind of get through to what your next goal is. And sometimes just getting adequate sleep is all we need at this critical moment, especially if you have insomnia. But in regards to what the evidence has shown us, there's no supplement or medicine that's going to help you have better sleep and create more testosterone. We do know that you do need a diet rich in all the important amino acids and important nutrients that we need to be alive. And usually you can get that from a healthy, unprocessed diet. Things like zinc are really important, folate, all the vitamins, of course. But you don't see an increase in testosterone production by taking a supplement of any of these medicines. A big one that people try to promote is, a testosterone booster with zinc, because zinc we know is important for that hormone production, but there's still no evidence to support that taking one of those supplements is going to actually cause a substantial increase in your testosterone.
So, can you give us some tips for someone who's having issues to fall asleep and to sleep better?
Think of your routine in general and start to carve out time to create a sleep schedule. Give yourself plenty of time to fall asleep and to have adequate time beforehand to have everything done so that you're not entering your sleep time with stress on your mind. Also, think about where you're sleeping. This is huge and something that I think is really challenging, especially when you're limited on space. A lot of us now work from home and we work in our bedrooms, which makes it a kind of chaotic place to try to unwind. So you want to try and remove as many screens from your bedroom as you can. You want to try and remove anything that you do in your bedroom that is not related to sleep, especially if you're having trouble falling asleep. If you can fall asleep with everything around you already, you just need to carve out that time, then you don't have to worry about that. But if you're sitting in bed and you're like, I don't know why I can't fall asleep, if there's a TV on your wall and there's all these things that you're used to doing in your bedroom that is not sleep related, that can impact your ability to unwind and relax. So those are the two main things I say. Of course, you want to also avoid caffeine at least 4 to 5 hours beforehand, especially if you're very sensitive to it. Personally, I can drink a nitro cold brew an hour before going to bed and fall asleep, but everybody's different. So think about what affects you in your sleep cycle and stages in sleep environment and try to pinpoint things that you can change to make it a more inviting place to relax and fall asleep.
Great advices. I'll definitely need some of them because I need.
You fall asleep in 2 seconds. Last night was the only night you had trouble falling asleep because
Yeah.
you took prednisone.
Okay, so now that we talked about testosterone, sleep quality, sleep cycles, cortisol, all of that, let's talk about some myths and some things that might be true, might be false. But let's just dive in.
Let's dive in.
Is it true that we can catch up the lost sleep over the weekend?
Right. So some people think, I'm going to have poor sleep for a day and maybe the rest of the week, but on the weekend, I'll catch up and get back on a good sleep cycle. And that's possible. It's possible that in a short few days, you can be very strict about your sleep regimen and get back on track. But you're not going to catch up in the sense of improve the functions that have already been damaged throughout the week. So your testosterone values and the normal hormone productions and normal biological functions that have been damaged for those 5 weeks before the weekend are not going to be repaired in 2 days. It's going to probably take weeks before your body is back to normal. So just because your sleep schedule becomes back to normal pretty quickly, those biological functions can take weeks, months before they get back on track. So you're not going to fix that damage over the weekend.
Is it true when they say I can function well with just a few hours of sleep?
That's absolutely true. Some people can function well with just a few hours of sleep. I've seen many people that I've worked with. I mean, when I was in residency working nights, I was functioning, in my opinion, well. On the inside, what was happening? It was not well. So no, in regards to how you feel or how you can function in your mind and get through your daily activities, yes, you can do that. But how your body's functioning on the inside, that cortisol level is extremely high, which is going to result in your body increasing the blood pressure, resulting in stress throughout all of the systems in our body. And of course, our hormones are going to be at their lowest levels. So it's not great to try and function, especially regularly, on poor sleep. Like those of us, unfortunately, who work nights or have done residency assignments know. I equate it to like a punishment or like some sort of painful punishment because I truly believe residency and working nights is what caused my testosterone to go so low and never rebound. So I still
Oh,
have a negative
trauma.
trauma because that's kind of when everything was happening to me. But yeah, nights were not good for me, and functioning may feel normal throughout the day, but on the inside, it's not good.
Never the same.
Actually, I feel like the last few years have gotten better, but I used to still wake up frantically checking my phone, thinking I was on nights because I would have dreams that I was still on night shift. And, you know, if you're frantically waking up hours throughout the night checking your phone, you're not getting good sleep. So it had a lasting impact.
So, based on everything that you taught us today, is it true that sleeping more hours will automatically boost our testosterone levels?
Right. So if you're already sleeping great, 7 to 8 hours a night, and your testosterone values are low, sleeping more is not going to have a dramatic or even substantial impact on making more testosterone. If you're thinking, oh, I'm going to sleep 12 hours a night and that's really going to help. Unfortunately, there's no data to support that. In fact, sleeping more than 9 hours a night can have a negative impact on your hormone production. So it's not that simple, unfortunately.
Okay, so what about drinking alcohol? Is it true that alcohol impacts in our quality of sleep?
Right. So some people think if they have a couple of cocktails before bed, it can help them to fall asleep and stay asleep. Some people will drink a glass of red wine thinking that it can relax them. And while that may be true, it can relax them. It actually can negatively impact the stages or cycle of our sleep. So what we see is people who drink, especially before bed, oftentimes have poor sleep quality. They're not reaching all of those cycles properly. And of course, their testosterone values can then be negatively impacted by sleeping in these cycles that aren't substantial or are reaching those, especially slow wave sleep or deep sleep and the REM cycle sleep. So do not drink a few alcoholic beverages before bed if you're worried about your testosterone values.
What about taking a nap during the day or sleeping during the day? Does that affect the sleep quality at night?
That's a good question. I love to nap. It's probably my favorite thing to do. There's no evidence that says napping throughout the day is going to harm your normal sleep cycle. And so I certainly encourage it. There's actually some studies that say sleeping in the middle of the day, like a siesta, is really beneficial. If you are substituting sleep that should happen at night for daytime sleep, there is some negative impacts that can occur. As we know, testosterone is produced while we're sleeping at night, early morning, and we do believe it's somehow related to our melatonin production, which happens in the nighttime specifically and is in correlation with our circadian rhythm or the night daytime cycle that our bodies are used to. So it is really important that you still get that adequate 7 to 8 hours of sleep at night and don't try to, cut some from the daytime because it's not going to work like that. But napping is great. Just don't use it as a substitute.
Right,
Use it
to
as
sleep at
an
night.
addition.
Extra.
Extra.
Extra?
Extra. Corn pudding.
That's a deep cut.
Deep cut. I wonder if anyone out here has had corn pudding.
Is it true that only older individuals need to worry about their testosterone levels?
That is a huge myth. I personally don't believe I am old. At least not yet. 33, almost 34. But yeah, so low testosterone can happen to anybody at any age. We typically see it happen more dramatically as we get older, but clinical evidence has shown that 1 in 5 men in their mid to late 20s is experiencing symptoms and signs of low testosterone. And so we're starting to see more evidence come forward, hopefully advocating for more men that are in their younger years to get at least screened with their primary doctor or doctor out there if they're having concerns or symptoms of low testosterone. So no, it's not just for older people.
Everybody.
It's for everybody. Disease for everybody.
Put it in the water.
Hopefully not. Let's put testosterone in the water.
Thank you for joining us in another great conversation with Dr. T and Lava Lamp
And G.
and G, the host.
Yeah, so thank you all for joining us as we discuss the bidirectional relationship between sleep and low testosterone and how sleep can impact our testosterone values. This is certainly a passionate issue for me. So we're very excited to talk about it and really talk about anything sexually health related. So if you have other questions or comments that you'd like to add to this discussion or things you want us to talk about next time, put it in the comments below. I think we're supposed to ask you to like, subscribe, donate, screenshot.
And if you have a recommendation of a name for this,
Yeah, what should we call this?
yeah,
We're
because
3 episodes
we
in.
don't have any creativity for that. So please help us.
Help. So we'll see you next time at the unnamed podcast, temporarily called the Tea.
Spilling the tea
Spilling the tea.
with Dr. T. NG.
NG. And Lava Lee.
In
This is
lava.
Lava Lee.
Lava Lee. Oh, wow. This is a drag queen.
TG and Lava Lee.
Lava Lee. TG and Lava Lee.
Love it. We'll all see you next time at the TG and Lava Lee. I wonder if anyone out here has had corn pudding.
Have you had corn pudding? Pardon?
Ding, 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 ding.
Ding, ding, ding.
Ding, 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 ding.